Good morning, my name is Francisco Marty. I'm an infectious disease doctor at Dana-Farber Cancer Institute and Brigham Women's Hospital in Boston. And been asked to talk a little bit about the Letermovir today. Just to summarize, the Letermovir trial was a phase 3 trial that was done in 20 countries, 67 centers in 20 countries, and we randomized 565 patients to Letermovir or placebo in a 2-to-1 fashion, and we found that Letermovir was very effective in preventing CMV infections during the treatment period, and the benefit persisted after the treatment period with some post-prophylaxis events that were expected. The safety profile has been is good overall. There's some minor gastrointestinal issues that just have to be kept in mind, and then and some atrial arrhythmias that were noted in secondary analysis of safety that we need to keep an eye on. Was only one instance of documented genomic or genotypic resistance to maribavir out of 325 patients in the primary analysis, so that's 0.3% or less, so that's very reassuring. And so that's one thing. In terms of the safety profile, again, very well tolerated. The completion rate was higher on the treatment arm than in the placebo arm. Was 78% completion rate, which is a very high rate of completion for a 14-week trial in bone marrow transplantation. It's the highest I've seen in ID compared with other trials that have been done in the past. So that also speaks to the tolerability of the drug. Letermovir is available as IV and PO, which is great because patients who are sick, especially those with gastrointestinal GVHD, will benefit from this drug and not be exposed to the myelosuppression or the renal toxicities of the other drugs that we have available. So that's another kind of good thing about this drug that we're particularly encouraged by. There was about a 5% absolute mortality benefit, or 33% relative benefit at 6 months that persisted through the 48 weeks of follow-up. It wasn't statistically significant the 48 weeks, which is understandable, but it was a persistent benefit, which is encouraging. My understanding is that the drug is now under review at the FDA, so we're awaiting the outcome of that review. We're very encouraged with the results that we've seen and analyzed so far. There's going to be a second trial, confirmatory trial in kidney transplantation, so I hope people who deal with these patients in the ID community and transplant community will participate. I think it's an important trial.